Here are 5 medical or clinical things to do after an abortion coming from someone with a background in healthcare. Please consult with your healthcare provider for personalized care. And this video is for educational purpose. In some countries, abortion is legal, while in other countries, abortion is illegal. Somehow they get the procedure done and it is considered an illegal abortion. There are 2 types of abortion: the medical abortion and surgical abortion. Medical abortion involves the use of pills to deliberately terminate a pregnancy, while surgical abortion involves the use of sterilized instruments to physically remove the product of conception, which is the fetus and other tissue from the uterus. Yeah, it's a deliberate act. The first thing to do is to get an abdominal ultrasound scan done. This scan is actually done before and after an abortion. In another video, I will explain why it is done or why it is required before an abortion. The abdominal ultrasound scan is done to ensure that the uterus is empty and there is no retained product of conception. The second thing to do is to check your PCV, which is packed cell volume. This blood test helps to show the amount of red blood cell you have in your body. So for an adult female, the packed cell volume ranges from 35 to 47. After the procedure, you will bleed. Light to moderate bleeding is expected, but when you start bleeding heavy, that if you soak 2 pads in an hour, that is considered heavy. And if the blood clots release is as big as a golf ball, it is considered heavy. So if you feel lightheaded and you soak 2 pads in an hour, you should go to the hospital. Yeah, you should go to the hospital. The third thing to do is to take a pregnancy test. Taking a pregnancy test immediately after an abortion will show that you are pregnant. Yes, this is because the HCG hormone, which is the pregnancy hormone, is still high. It's still high, so it will come out positive. It is advised to take the pregnancy test 3 to 4 weeks after the procedure. And one thing you should take note of while checking is you should check how faint the line is. If the line is faint, that means there is no retained product of conception and the pregnancy hormone is gradually wearing off your body system. But if the pregnancy test, that line is thick and bold, it means there is still a high level of pregnancy hormone in your body system and you should go to the hospital for further assessment. Monitor for infection. Signs of infection include foul smell, abnormal discharge and other signs. So you should monitor for infection. If there are signs of infection, please rush to the hospital for evaluation, because if you leave the infection untreated, unattended to, it can ascend straight to your reproductive organs and cause further damages, which is what you wouldn't want. Avoid dodging during this period and maintain a good personal hygiene. Please consider a contraceptive method. There are different types of contraceptive method, because after an abortion you can get pregnant almost immediately. So I believe you wouldn't want to, after going through this process, you want to go through it again. So consider a contraceptive method. In another video, I'll list out the types of contraceptive method. And please